Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Transitioning from a quiet classroom lab to a fast-paced hospital clinical placement can feel overwhelming. Textbook patients are cooperative and hold still, but real-world patients are in pain, post-surgical, or unable to follow commands. Today, we are diving into the Technologist Survival Guide. We will break down how students can master clinical confidence, manage difficult positioning challenges, and apply critical physics formulas on the fly when the pressure is on. Every single technologist remembers their very first day of clinical placement. It is completely normal to feel like an imposter when you step into a busy department surrounded by experienced staff. The key to surviving and thriving is moving from passive observation to active engagement. Don't wait to be asked. Help with patient transfers, clean cassettes, set up rooms, and remember that asking questions before making an exposure-strong clinical judgment, not weakness. For patients visiting an imaging department, having a student technologist involved in your care is a sign of high-quality, attentive service. Students work directly under the close supervision of certified, registered technologists. Having two sets of eyes in the room ensures your positioning is precise, your comfort is prioritized, and your scan is completed with the highest attention to detail and radiation safety. In the classroom, you memorize formulas on the floor. You use them to solve problems in seconds. The 15% rule is your most powerful tool when dealing with uncooperative or mobile patients. Increasing KVP by 15% doubles beam penetration and receptor exposure, allowing you to cut your MAs in half. This drastically reduces exposure time to freeze motion while simultaneously lowering patients' entrance skin dose. Portable radiography rarely offers standard distances. When IV poles or traction devices prevent standard 40-inch or 72-inch setups, you must adjust technique instantly using the direct square law. Remember, if your distance increases, your beam intensity spreads over a larger area according to the inverse square law. You must scale your MAS proportionally with the square of the distance to prevent underexposed, noisy digital images. Grid cutoff is one of the most common reasons for repeat portable exposures among students. When using focused grids on portable beds, the primary central ray must align perpendicularly with the LED strips within the specified focal range. Tilting the grid or angling across the grid lines absorbs the primary beam, causing severe image receptor underexposure and noisy digital artifacts across the image. A great technologist moves the machine around the patient, never forces the patient to match the textbook. When positioning trauma patients with suspected fractures, never force anatomical rotation. Master cross-table lateral techniques, angle the tube to match anatomical foreshortening, and utilize positioning sponges to support injured limbs comfortably while maintaining orthogonal two-view standard principles. Digital image processing automatically adjusts image brightness, which can dangerously mask severe overexposure. Students must consistently monitor the exposure index on their console. If your EI is significantly higher than target values, you are contributing to dose creep. Conversely, underexposing results in quantum mottle that cannot be fixed by post-processing. Strive for optimal technique that delivers diagnostic quality at the lowest achievable dose. Technical skills will get you through your board exams, but emotional intelligence and communication will define your clinical career. When managing high-volume shifts or frustrated patients, clear, calm communication is everything. Keep patients informed about wait times, introduce yourself warmly, and communicate clearly with nursing staff using structured handoffs to build a collaborative, low-stress working environment. Clinical placement is where you build the skills and confidence to become an exceptional medical radiation technologist. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.